Lights. No, it's fine. We'll manage this. One more there. There's one more chair there. Oh, okay, fine. Sure. No, please sit, sir. Please sit.
Now, I request President of JWGC to hand over small bouquet to Dr. Kushalappa.
Thank you.
And I request the captain to hand over a bouquet to Dr. Sumit Bhandari.
Thank you, sir. Thank you for having us.
And I request the secretary Sudhir Bhatt to hand over a bouquet to media.
Aditya.
So he's an expert influencer, media person. So I request President Arun Kumar to say a few words.
Good morning, everyone. It gives me a pleasure to welcome you all this post-injury clinic here. We welcome Dr. Kushalappa. This is Sumit Bhandari.
Thank you, sir. Tarun sir, the Sai Golf again.
Social media, Mr. Aditya. This special day, we also pay respect and extend our warm on this occasion to India Ambedkar Jayantini. Remembering his remarkable contribution to the Constitution and nation. I would like to sincerely thank you, JWGC Dr. Association, Secretary Sonia, Dr. Narayan, for wonderful initiative. Such a effort go a long way in promoting health, fitness, and well-being of our members. Also, I encourage all of you to make most use of this opportunity, do consult experts, take a proactive step towards your health. Wishing the great success. Thank you.
So thank you very much for JWGC committee, office bearers in the committee for providing the premises, also giving us all the support in conducting this workshop. I hope this kind of workshops will go on from here and to many other workshops, so that our workers can utilize the opportunity and then be informed of so many things. Thank you. And now, first Dr. Kushalappa will speak,
Yep.
and then afterwards there will be an interactive session. So you can always ask questions, and then as already said, if you have any reports, you can show to them. They will guide you how to do it, and then how best you can play your role without hurting your. Thank you very much. I'll hand over. Yeah. I'll ask Sudhir to say a few words.
Good morning. I'm grateful of speaking God is a very vicious kind of thing on the body. It's a very violent action on the body. So naturally, we need to take care of our body before we attempt it. There is a problem here actually. We should be fit to take off, or we take off and become fit. This is a confusion which I always had. I'm not individual. My spring changes have led me to a lot of problems. Anything and everything is related to this, and especially when we play in the morning, we're not thoroughly warmed up. So that also leads to this. I am very sure that this program and many of such programs will help us, all golfers, in becoming healthy, fit, and play golf forever. Thank you so much for letting me know that. Thank you, Dr. Sumit.
So investor can also sit there. Then I hand over my to Kushalappa.
I think we just get the lights also.
Yeah.
Those lights. Light. Good morning, everyone. Thanks for turning up on a Tuesday morning. I know it's a bit of an odd day of the week. I'm hoping that we can make this more regular, and then in that case, we'll turn up on days that are more sort of amicable to everyone here. So I think the question after Dr. Sudhir Bhatt just spoke, I think the question everyone asks is which came first, the chicken or the egg? So with the golf swing also it's similar. Did you change your swing because of an injury, or did the swing chase cause the injury? So I think all of us sort of asked that question, and hopefully today myself and Sumit will try and answer some of that. I think before we start, special mention to Dr. Sonia Timaya, because this was something that just came up very organically. She saw a post of mine, got in touch with me and said, hey, this will benefit my members. I want you to come and do this. So hopefully this starts and it can build into something more in the future. So today, just to talk about the clinic itself, we're going to do it as presentations run by myself and Sumit. This is just to give you some information that we might have in a perspective that we have that you all may not have. Following that, we're going to do breakout sessions. So I'm going to be running a clinic and I'm going to look at each individual person with issues and see if I can help you. I'll give you an assessment from a doctor's point of view, and then Sumit himself is going to be running a breakout session to try and help you from your day-to-day sort of rounds and see what you can do from a pre and post round sort of warm up and cool down to improve your sport and improve your game. So coming to the first thing, the golf swing. Now, the golf swing, in all honesty, is something that I've had to sort of teach myself. I have a very big obsession with biomechanics. So whenever I look at a sport, I break it down into what the body is doing in each stations of the sport. So with the golf swing, actually, there's so much data around it because people are so obsessed with it. And I think we've seen a lot of variations over time. And in essence, basically, a golf swing is divided into two types. Sorry, missing a slide maybe. Anyway, so coming to the types of golf swing, so essentially they're basically two types, the classical and the modern, and I'll go through it. Just to give you a brief about my background, to tell you whether I'm in a position to actually talk to you about the golf swing. So in all honesty, I have no golf experience. I played one round of 18 holes golf. That was in this beautiful course, which was in Sydney. So my professor took me there. He gave me a bag of about 20 golf balls and he said, don't worry, these are all old golf balls. Finish the 18 holes, let's see how many you come back with. I came back with 18 balls. So I lost only 2 and both of them went into that water body there. So that's why I included that in the slide. Now, in terms of my actual experience, I played a lot of hockey. And to be very honest, I feel that gave me a bit of an idea, a bit of understanding on how to contact the ball. So I was very good getting off the tee, but once you put me on the green, the ball will fly to the other side. So that I hope that changes with time. Now, coming to my experience apart from that, so during my time in Sydney, I worked in the Sydney Shoulder Research Institute. So we had a lot of association with the athletic population. So we used to see a lot of golfers. We used to see a lot of people with rugby's, AFL, surfing backgrounds. I currently do a little bit of consultancy work with Go Sports, which is more Olympic athletes. So a lot of boxers, weightlifters, runners, jumpers. Then I do have an association with Tarun Sardesai, and I work closely with Sumit as well. So we see a lot of the junior golfers and their sort of injuries and try and work with them. Apart from that, I'm a full-time consultant at Narayana Health. I look after the shoulder, elbow, and the sports practice over there. And I've got a diploma from the IOC in sports medicine. So I'm hoping all of this gives me some insight. So we're going to break it down into the types of swings, phases of the swing, backswing, downswing, what is the difference between a professional golfer, amateur golfer, and also what are the kind of injuries that you would most commonly see. And I'm sure a lot of you all can feel some relationship when I start talking about injuries. So golf swing. This is basically a clip from a movie. I'm sure some of you all might have seen it, Happy Gilmore. And it's basically just to highlight how you have so many variations in a golf swing. I'm sure within your 4-ball also, everyone's got a different golf swing. Some of them work, some of them don't. And I think the important thing when you're looking at golf from a performance point of view, you want consistency. But from an injury prevention point of view also, you want something that is very clean and efficient. So that's why we come down to what we have nowadays. So we have a classical swing and we have a modern swing. Now, classical swing was basically with heavier clubs, courses that were a bit shorter, and an understanding that the population that played golf in and around that time was more, I would say, elder. Nowadays we have modern swing, which is because the clubs have changed. We have more graphite, we have more flexibility in the clubs. Courses have changed, they've become much longer, so yardage is important. And also, if you look at the people or the profile that are getting into golf, the younger people that come from background, especially in the US, you see a lot of people who are playing baseball and then getting into golf, and that swing sort of correlates from there. So the phases of swing, generally we break it down into the address, where you sort of walk up and mark yourself up to the ball. We have the backswing that is subdivided into the initial phase and then the top of the backswing. And then we have the downswing, where again it's the initial phase, the point of contact, and then the follow through. So in each situation, we have a difference in terms of what is going wrong and what can go wrong. And generally, the interesting thing with golf is it's an asymmetrical sport. You have certain parts of the body that are going into sort of extension, you have certain parts of the body that are going into flexion. So at any one point in time, your body is doing two different things. And those two different things are trying to be synchronized together to give you the best sort of performance. So if you look at the backswing itself, you're divided into your trail and your lead. So just from your your shoulder going back, it's basically going into a lot of abduction, external rotation, and along with that, the muscles that are getting activated are more the trapezius. So people who have pain in their neck, pain in their upper back, that's more because of your trapezius load when you're sort of going into your backswing. Now, in terms of the your rotator cuff muscles, it's also a lot of your supraspinatus and infraspinatus that gets loaded. And also it comes from your lower limb. So when we're looking at the lower limb, the trail leg, there's a lot of focus going into your hamstring because the load transfer goes into your hamstring at the back. What about the lead? So the lead limb is more the arm is getting tucked in. So it's more the muscles that pull it close to the body. So you'll feel a lot of load in your pectoralis and your subscapularis. And then when we go into the downswing, there's sort of an alternate reverse where now that you've sort of cocked up and you're ready at the top, we need to recoil and bring that force down into the ball. So from going into abduction, we're now going into adduction. So that means we're activating the pec, we're activating the subscap, and we're activating the serratus along with the glutes. So this is a big difference in the modern day swing, and I'll come to this a little bit later. But glute activation, glute power, glute strength, that's very important when you're sort of looking at your yardage. Coming to the lead shoulder, again, we're getting activation more in the trapezius and again the hamstring. So like I said, it's an asymmetrical swing. So you get muscles that are active at one stage, that are inactive at another stage, and vice versa as well. So this balance is very, very important. And if we look at the data around the comparison between professional golfers and golfers with a low handicap, middle handicap, and a high handicap, what we tend to see is that the pro golfers, or the ones with low handicaps, they actually achieve a much better external rotation and abduction in their trail. And with their lead arm, they're able to get a lot more across the body. So this is when we come into the modern swing, when we're looking at the X factor. So basically, we're looking for a dissociation between the shoulder and the hips. So the more you're able to rotate your shoulders away from the plane of your hips, the better sort of contact you get, the better force you get, the more yardage you get. So that's what basically the pro golfers are able to achieve. Now, along with that, when we look at the glutes, so in terms of the contraction and the strength from the glutes, the pro golfers, the low handicap golfers, they have more strength in the glutes. And they're able to develop a lot of pelvic rotation, which gives them, again, that extra boost that gives them more yardage. And what's happening with the lower limb is there's more internal rotation in the lead leg. So they're able to internally rotate and really get behind and then follow through with that. So basically, we need a lot of flexibility in terms of your shoulder movement and also your pelvis and your hip to be able to get to the ranges, which will then allow you to power through with your glute to get you the distance that you need. So in conclusion, like I said, it's a very asymmetric sport. Load distribution is based on the phase of swing. So based on where you're having the issue also, that's where we know to sort of isolate and identify the muscle that is causing you the issue. Now, distance in terms of yardage is divided into mobility and strength. Mobility means we're trying to get your shoulders that you can really reach around. We need the pelvis to sort of rotate. We need the dissociation, and also the strength comes from the muscle, which is basically your gluteus. Now, in the modern day swing, like I said, there's a big shoulder and pelvis disassociation, a lot of trunk rotation and lateral bending, and this plays into why we have a lot of low back injuries. So most commonly, the Masters got over on the weekend that passed. Rory McIlroy has struggled with back issues, and he's got one of the best sort of swings and the most yardage. And that's probably related to that sort of lateral bending and trunk rotation that he develops. So coming to injuries now. So in general, like I mentioned, so the most common body parts that are injured in a golf swing are the shoulder, the elbow, the lower back, and the wrist. I'm sure a lot of people here must be able to relate with this. Apart from this, we do have injuries with the knee and ankle and everything else, but these are generally the four most common areas. And this is from literature out of the European leagues, out of the American leagues. So this is consistently what people tend to suffer from. Now, when we look at the shoulder, there is an association with how much you play. So people who play 4 rounds per week or hit more than 200 balls per week on the driving range, they tend to have more shoulder injuries, and these are more overuse injuries. So it's not one traumatic event where you sort of hit into the ground, but it's more over time, the muscles sort of fatigue, and then you start developing an issue. So again, this comes back to which came first, the pain in the shoulder that changed the swing, or the swing that caused the pain in the shoulder. So it's a bit of both in this scenario. Now, increasing X factor, that's again the sort of disassociation. So the more force, the more rotation, the more reach, the more terminal range you're getting into, that's more of a risk factor for having some sort of shoulder pathology, like an impingement or a rotator cuff tear or any sort of issue like that. Now, again, poor swing technique also contributes to it, and overzealous play. So when you have that tournament that comes around and you're like, okay, today I'm going to try and break my personal best, and you put a lot of effort into it, that can also cause issues. So I think when we're talking about golf and golf swing, it's about consistency. Things don't change overnight. This is more you practice, you perfect things, and then you sort of get to it at a later date. And then there are traumatic events. So the most traumatic event that you can have when it affects your shoulder, elbow, and your wrist is impacting into the ground. Now this I'll speak about in terms of professionals a little bit later, but apart from that, shoulder injury is most commonly seen in the non-dominant hand. So for a right-handed golfer, you'll see it in your lead shoulder most commonly because it reaches around and goes through a lot of range. Younger golfers, we see more instability, so dislocations are more common in young. Akshay Bhatia, I'm not sure if people saw that. I saw it because, like I said, for me, sports and biomechanics. So he was actually celebrating and he high-fived his caddy and dislocated his shoulder. And if you look at his swing, the way he sort of rotates around and the ranges he gets, he's definitely got some hyperlaxity, and that's how he's so good. Middle-aged golfers, we see more impingement, rotator cuff tears, AC joint pathology. And for the elder age, we see more rotator cuff tears and just arthritis in the shoulder as well. Now coming to the wrist. Yeah.
Shoulders in the range of about 200 balls. What do you suggest that you take a break after some time so that this is prevented? Say about 50 balls a day.
So when we're looking at overuse patterns of injury, generally it is about cumulative loads. So you have to think about not only taking a break, let's say 10-15 minutes, because that is not adequate enough for your body to recover. But if you are looking to hit 200 balls in 1 week, you've got to space it out. And I think the important thing with golf and any other sport is also mixing up your exercises. So just playing golf for competition, playing golf for fitness, playing golf for health, and then not doing anything else doesn't work. So you have to put in some work apart from just the driving range, which is work in the gym, work with the physio, work in the pool, doing other things that also help complement your sport. So that's the way you sort of prevent it. 200 balls is just an assessment, so you know at least your sort of ceiling. But I'd say apart from that also in terms of the way you structure a week, you should break it up and not just look at playing golf every day of the week. Yoga also helps. So yoga helps with a lot of flexibility, a lot of mobility work as well. But see, again, with yoga in isolation, just mobility, flexibility is not going to get you the strength you're sort of demanding. So it has to go a little bit in tandem with some strength training. And see, strength training as we get older becomes a little bit more important, not only from golf, but also from a sort of protective point of view. So you're protecting yourself in the future from a fall, you're protecting yourself in the future from a fracture, you're improving your bone strength. All of these things come through strength training. So yoga is good from a sort of breathing point of view, pranayama, concentration, flexibility, but strength training is also very important. Okay? So going into wrists, wrist injuries are more common in professional golfers, and this is basically the sort of way in which they hold the clubs. Also professional golfers generally when they try to put a lot of backspin, so they impact into the ground and take a bit of a divot, and that also causes more traumatic injuries to the wrist. It is again seen more in the non-dominant side, so on your left hand for your right sort of handed golfers, and it depends on where in which the wrist, what structure is sort of damaged. So this can be more tendinitis, or can be impingement, or can be just frank sort of instability and dislocation as well. Now coming to the elbow as well, again it is more to do with the way in which you grip the strap. Yeah.
Sorry.
No.
See, when you said the wrist,
Yes.
the start of the left hand for a right hand
Golfer.
doesn't keep
So that would actually come down more to your grip. So when we're looking at the grip, you don't want to be too tight and sort of holding the club as well. But at the same time, you want a neutral wrist. So see, at the end of it, you have to look at it as load transmission. So it's a kinetic chain. So what we're trying to do is get that club head over here and then take it all the way down to contact the ball. So the way in which we get the force generation has to actually start from the legs, go up through the torso, and the hands and everything are just sort of conduits. So we're not looking to generate force with that grip, we're not looking to generate force with the wrist or the elbow or the shoulder. That is coming more from your rotation. So the thing is that when we lose rotation because of whatever hip issue, spine issue, everything, we try to compensate with the shoulders and other body, sort of other joints. And when that happens, then you start having other issues. So you'll notice that because at the point of striking, because you've not got rotation movement, you're holding the club harder to sort of push it like that. That can cause issues with your thumb. And then lower back. So lower back is a very, very common injury nowadays, and this is more to do with how the golf swing has changed. So earlier classical golf swings, you were sort of more upright, you were rotating all the way and then rotating back down. But now, as I said, it's gotten more into your sort of pitcher's swing. So there's more sort of rotation into it, so you're getting more of the X factor. There's more lateral bending when you sort of release and you're trying to impact the ball. So you, in the current day golf swing, if you look at the analogy, you go high up top with your follow through, and when you come down, you're sort of coming closer to the body and trying to sort of whip it. So that whipping motion puts a lot of strain, especially on your, so for right-handed golfers, you'll get more of a crunch on your right-hand side as well. So these sort of things, low back aches are more, I'd say, in relation to a lot of issues with the load transmission, and also it requires strengthening of your muscles of your abdomen for your core, and also again the glutes. So if you have a good foundation, you have a good base, then you can sort of avoid injuries, also improve your game and improve your distance. Okay, so this is basically, just to conclude, a little bit of a difference between professional golfers and amateur golfers. So as you can see, professional golfers, more common to have low back ache, but that's more to do with the kind of forces they're trying to generate. So they're more traumatic, whereas amateur golfers have more upper limb injuries because they kind of forego the rotational movement and then concentrate more on the upper limbs. Other common injuries are wrist and shoulders, like mentioned. And like I said, it is more repetitive with professional golfers, and then it comes down to poor technique with amateur golfers. So, I mean, this is just an overview as to what I've sort of understood from golf. My lens is a bit different. I'm sure Sumit also is here, and he'll give you a different idea as to how we can prevent it and how we can sort of diagnose it as well. So if there are no further questions for now, we can open it up later. I'll hand it over to Sumit, and then Sumit will sort of take you forward. Yeah? You need it?
Hello everyone, good morning. I think, am I audible to the last gentleman there?
Any questions?
Okay, I would like not to use mic. I generally like my hands to be a little free. Thank you ma'am, and thank you all of you for being assembling here and hearing me and Kushalappa's perspective on injuries and how to prevent on them. I would like to thank JWGC Golf Course for allowing us to have this session here. My expertise, I am Sumit and I work with Tarun Sardesai Golf Academy. We are a golf academy, fully residential golf academy based out of Kolar at Zion Hills Golf County. We expertise in high performance golf. We train a lot of young golfers, but at the same time we are open to training all the adults and master golfers who also want to learn this craft or want to take it to the next level. So we have all sort of programs working on that. I would like to take this session on how the injury patterns are happening in an adult and how to work around them. Maybe I'm sure we can work around a lot more on the hands-on sessions after the presentation. I'm sure the goal is to make sure that when you go back, you should take at least 2 to 3 things out of here which you would like to implement in your lifestyle to make sure that you are trying to prevent that one big injury which may come. Right. So, like Dr. Kushalappa mentioned, we are not sure whether we are trying to, be fit with the golf or to be fit to play golf. Golf sometimes is a little bit misinterpreted. It's been misinterpreted as a low risk injury to the sports, but what the research says that one of every second golfer, amateur golfer, he has gone through some part of injury, and 75% of the professional golfers at some point of their career, they'll also go through this injury phase. So which I believe is one area where we would like to work around. Like Dr. Kushalappa mentioned, I think elbows and forearm in an adult amateur golfer are more common. That is purely because of the loading pattern of an golfer, and followed by a lower back, again consistent to the same thing. Now let's just categorize these injuries, that where all they come from. I'll start with basic acute injuries. There are very few instances where we'll have more acute injuries, considering an adult population. Maybe a bad duff will lead to, or a high impact swing will come back into your lower back and you'll feel like a catch, which may turn into an injury later on. But most of the injuries are coming from an overuse. More number of swings, repetitive movements with lesser frequency. That is one of the prime reason why you'll have this injury. Apart from that, load spike. This is something which is very commonly observed in an adult population, where you are mostly busy working and then you use this sport as a recreation. But at the same time, we do not understand that how much load we are trying to push our body into in that particular 5-hour session or 6-hour session, comparing to my last 4 weeks. That's something which is again a very common reason for us to have that injuries. Another reason is the muscular asymmetry. Like Dr. Kush mentioned, that it is an asymmetric sport, but that doesn't mean that we will always, let it happen. I mean, we always have to keep working around it to make sure that the asymmetry is balanced by the counter movements. The forces happening in particular direction has to be balanced by the counter movements. Okay, that's something which is very common, why we see a lot more injuries in an adult golfer. Now, from your perspective, I would like to understand how many of you have got injured, or may felt a pain, ache. Okay, all right, at least 50%. Okay, so I promise. That's okay. Maybe that is why we have that 1:2 ratio. Yeah. Okay. So I believe there are 5. These are the major contributing factors which may lead to the pain and ache which we'll go through. We'll start with very basic movement limitations. Limitation in the muscular flexibility and mobility, where you're trying to generate force but your muscles are not allowing. Imagine you are just stuck there and somebody is asking you to hold a club and swing it. Is it possible? Obviously, it is possible to hit a ball at certain distance, but if you're trying to generate more force, what is going to happen? To generate that force, you're going to use a lot more of your forearm, because that's the only available range of motion, right? And that is where you need a lot more mobility all around the joints to make sure that your swing is complemented, right? Second thing is the swing mechanics. Again, this is one of the prime reason, even in the adult young golfers, where we have observed how the swing mechanics changes the force pattern, the force generation, and leading to an injury. Like Dr. Kush was mentioning, a lot more adult golfers try to swing more from the upper body. But when you see professional golfers, they try to use a lot more of the hip drive to generate the force, and while arms and forearms and shoulders are just being used to transmit the force. But it is the other way around in the case of golfers. And I'm sure once you are picking up a sport later in the later stages of your life, it's very tough to pick the techniques, and that's where we need to do more drill work, more range work, rather than having more course work, where you're trying to get a result. Yeah. Third is the strength deficit. I believe it is one of the primary reason why adult golfer will get injured. If you do not have enough strength in your muscles to generate that force, you will end up pulling one wrong muscle. That's something which I feel after this presentation, I would like you to, start working on the strengthening of different muscle group, which Dr. Kushalappa just mentioned a few minutes ago. Next three are my personal favorite, and this is something which I believe is helping us in the academy. We work a lot with the young golfers where, again, they are equally at the risk of getting these injuries if not managed very well. And this is something we believe we work very well around with, that is loading and scheduling. I mean, you cannot have one round of golf every week, because what is going to happen is, on that particular day, for that particular number of hours, you will have a sudden load spike. And your muscles are not ready to take it because it's going to be once an occasion. So you want to schedule your golf a little more better, manage that load, that training load in that particular session, and you need to match that load with past 4 weeks or 3 weeks just to get a better outcome. That could be a strength session playing different recreational sport, or maybe practicing more with more consistency. Yes, sir.
Suppose you said that if you're playing only once a week,
Yes.
you have to spread it out.
Yes.
Say that you go to the range,
Yes.
or you do some other activities so
Yes.
that your body is
Yes.
in tune to
Yes.
some kind of
Correct.
strain which comes on the course.
Correct. So, okay, sir's question is how to manage the load effectively throughout the week, if I'm not wrong. Okay. So, at our academy, with our current population of athletes, we train them more than 27 hours of golf throughout a week, 8 hours of fitness. And on top of that, we add them with more recreational sports. Now, what I simply mean is, whenever they are having a session, they spread that session in a way where they hit around 45 balls in close to 60 minutes. And that too, because that's what the ideal way of working with golf is, because you just don't want to put a ball and swing it, because there has to be an intent up behind every swing, right? So you put the ball, you come back, set up your line and take it. And in that case, it takes around 45 to 50 seconds to finish one swing. So in that case, I would recommend is, each session, each hour, you do not hit more than 45 balls with the consistent breaks. And you can schedule your session as in that, okay, I'll start with some short game, move into the long game, and then come back with putting, and then come back another bucket of long game. And that's how you manage. So ideally, with the current scenario, what is the current trend is the ACWR, which everybody follows, and that's what we also follow. It is acute chronic workload ratio, where you compare today's workload with the past 4 weeks to get an outcome that whether you are overloading or you are underloading. And the moment you start tracking that, you will understand on particular days you are overloading and the load is going beyond 1.5, which is the highest threshold which we need to go. And on particular days you are underloading. On not just particular days, on most of the days your load is being underload. That is why that sudden spike is happening. So that's the reason why a lot more golfers get injured, not even in adult population, but in a professional circuit as well. I've seen so many professional golfers struggling. But I'm proud to say my professional golfers, in last two years, the current lot which we have, apart from one major injury, they do not have any load issues. It is very precisely monitored and tracked. And that's what I would also like you to understand, that write down how many number of balls each day you are hitting. And then you keep comparing them with past 4 weeks. So you understand that on what day the load is going and what day the load is down. That's how it should be managed, if I have answered, sir.
So for the entire week, if you do it, then what do you suggest? Like you play.
Okay, so when we say load, we are not mentioning the number of balls you're hitting. It is the number of minutes you have spent on particular activity into how much tired did you get. That is what we call as a rate of perceived exertion. That is RPE. So you track the number of minutes into RPE, you get a particular volume. And you collectively add that volume for that particular day. For example, if you have done a strength session, say 60 minutes into RPE of 5, that gives us a 300 as a number. Likewise for golf. And you keep adding that number for that particular day. And then you keep matching that number with past 4 weeks. So it will take some time to get that results, like as in to filter out that, okay, how precise my load is being monitored. So it should take time, but the moment it starts giving you that result, there is no going back. Then you can exactly understand that, okay, today I have pushed a little extra. My course session was pretty humid, and on a regular day, if I am walking for 5 hours, if it's giving me RPE of 4, Today I've gotten given 7 because the conditions were not great. Maybe my nutrition was not good. Maybe I wasn't ready. My sleep was not right. So that's how you manage the workload. Yeah.
See, in the case when you're playing around, especially in summer, what my experience, that the drainage of your energy is because of the heat rather
Correct.
than because of the game.
Correct.
So, how do you?
That is what I was trying to mention. That is the rate of perceived exertion. Like how much tired did you get? I'm sure you must have played multiple rounds, but each day you are not tired. There are some days when you are less tired. There are certain days when you are more tired, and that's where a lot of strategies will come into play, and we'll talk about them in coming slides. At how to manage those strategies as well. Then comes the last, recovery and lifestyle. That's something often people miss out on, not just the adult population and the younger ones because they do not have knowledge, the professional athletes because they are more occupied with peers and everybody, but the right people of right kind of athletes, the right group of athletes, they prioritize their recovery more than any of the bottom part because that is what gonna set them for the next day. And that's something which is more important, like how you eat after a round. You know, how much is your sleep before and after the round? What is your recovery protocol? You need to find it out, and for each and every athlete it is very different. So you need to find for your own that, okay, for me I think 20 minutes pool dip works, but for certain people it may not. For certain people an active, good active prolonged stretch may work, but for certain group it may not. So you have to keep trying different things and find what is working for me in that case. So that's how you work on. Next, let's try to solve these simple problems. You start. Prevention of injuries is very simple. I mean, we generally overcomplicate it. It's just that if we start looking at our day-to-day and if you start working on it, I think it is very simple. You start with a basic, very good warm-up. Start adding a lot more muscle activation to support your swing. Followed by the technical mastery, which you can do it with a certain coach. You can go into more sort of biomechanics, like for our in our academy, for our adults also, we take force plate. We have our force plate, which helps us understand where the force is being transmitted from, and that's where our coaches work around with our adult athletes also. And that's something which you can always work around with the coaches. Followed by strength and stability. This is something which I am sure you do not want to miss out on. You want to be stable. You want to play this sport not just for like maybe next couple of weeks or months or years, but for a prolonged period of time. So that's where I think the longevity of your golf career depends on the strength and stability you have. Followed by the effective load management, which we just discussed right now, and of all, the recovery and nutrition part. And that's something which you want to work around. Any questions on this side, sir? I would love to answer. Okay. To talk about strength and stability, you all have, how many of you go to gym? Nice, I have 1, 2, 3. Yeah. Okay, so this is something which we want you guys to understand, that hitting the gym is not about being explosive in the gym. It is also about being consistently lifting the weights in a most safe way. Whether you are a 8 or 9, 10-year-old athlete lifting 3 kg dumbbell or a 45-year-old lifting 5 kg dumbbell for any particular movement, it is needed. It is needed to make sure that your muscles are getting some amount of stimulus apart from the sport which you are playing. In that way, the muscle loss which Dr. Kushalappa was mentioning will get prevented. It will also add certain amount of strength to your body, certain amount of strength and power to your swing. Because a lot of you want to swing fast, you want to make sure that the ball should go further, and with the best of technique, even if you work with the best of coaches, if your muscles are not strong, if they are not able to support the swing, you will always end up injuring. Sir, I'll come back to you just. Yeah. So, one very basic example is golf is one planar sport. There are a lot of force being directed towards the finish. But what about working on the counter movement of this? You also want the muscles to support. So the moment you are hitting, you also want these muscles to support you, to hold it, to be stable. You don't want the swing to be just like looking like that. Correct, if I'm not wrong? So that's why a lot of strengthening and stability comes in very comes in handy to make sure that A, you're preventing, B, to boost your own performance on the golf course. Yes, sir. I'm sorry. Yeah. Yes. I'm sorry, sir. I didn't get your question. Yeah. Yeah.
Isotonic exercise and isometric
Yes. 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 Mm. Yes.
But that is against the golf swing because rigidity of muscles and you don't have a smooth swing. So what weight do you recommend for
So for
the amount of weight you have to lift on
yes. So for each and every person sitting in this room, including me, Kushalappa and Aditya, we will have our own like plan to work around. We have our own goal. We have our own shortcomings. So every time you cannot generalize a strength session to each and everybody on this floor. So every time you start a strength session, if the strength and conditioning coach is very smart, he has read what hits need to be done, he will always start with a screening. That screening in our case starts with a functional movement screening to understand that what are the injury pattern, what may be the injury pattern on the strength floor. Then comes the movement pattern screening, where it could be as simple as how effective your single leg hop is, because this is something which we want to include in our plan, followed by a strength assessment for the proper trained and professional athlete. To answer your question, you cannot generalize one strength exercise for anybody. It is supposed to be always in a very progressive way, started with a proper screening, and there's no end to the strengthening of an adult. You may see I also participate in running. I'm sure you must have seen a gentleman from Bangalore called as Barefoot Bobby. His body looks so jacked. And when you see him training on his Instagram, the amount of training which he does to his age, he's 60 plus, but he is amazing. But at 45, there'll be people who do not do that. At 33, I do not do that. But it's again, depending on person to person, that strength session will have person to person, and there's no limit. The more consistently you do this, the better outcome you will get, and the better outcome you get, you'll again end up doing it more. So that's how it's supposed to be. Yes. My question to everybody is, why are you afraid of gym? What is there in the gym which will make you injure? With the body weight training, there'll be particular stimulus which will aid to your body, and after that there'll be a stagnant. So you still need certain loads after that. You can start with basic band activations to start with, get that stability, and then you need to add particular number of weight. So if I have to train a 50-year-old athlete, with a squatting pattern, I would start with a basic squat, adding some resistance band on the knee to activate little glutes. That is one level up for the stimulus, and then I may add a 5 kg dumbbell. So it is as simple as that. So I would personally say, do not hesitate to go to gym, but yes, meet the right kind of trainers who understand how to train an athlete, because the moment you are on the golf course, you are just not a normal person. You are acting like a recreational athlete. So you should train like one. That's what I believe in, yeah. So. Okay, sir. Yeah, we'll come up in the coming slides, if you may. All right. Thank you. All right. So there are a couple of signs I believe you should watch out for every time you go on the golf course or you're practicing at the range, which could be if your yardage or swing speed is dropping, if the stiffness is lasting more than 48 hours, if the energy levels on a particular days are dropping, if there is a pain during the swing, if you feel the motivation level to go to the golf course or to play around is dropping, if you do not feel hungry enough, or if you feel anything around is off, I would personally say step back from that, step back from the golf. Take it easy. Maybe, tweak the session a little bit more. Instead of going to a driver, work around the short game. Yeah? Sorry? Okay. So, these are the signs which you want to watch out for, and these are very important signs because eventually one of them will lead to a further injury, and that's something which you want to keep a track of.
Suppose you find that you have some of these issues when
Yeah.
you're playing the course.
Yeah.
What do you advise? You just withdraw?
No. So again, this is a very sensitive call, and to understand, the intensity of the pain, or generally in the case of pain, we say if the pain is going more than 4 and it has not been produced because of an impact, you can just pull out. But with others, I'm sure the moment you go at the driving range, if you observe the swing is going down, the speed is going down, you want to be a little more cautious about it. You can still finish. I'm sure you don't have to immediately pull out. But with the case of stiffness, if you feel I've been having stiff back for the last 2 days, I do not have to show up to the golf course. It will only add to an injury. Again, very subjective to what you're picking up. If your energy levels are not great on a particular day, if it's very hot, you need to add a little more extra nutrition on that day. And if you feel, okay, I can play 9 holes, let me see after that. You can take that call after 9 holes. So it's all about preventing the injuries and being a little more safer, because maybe that extra 9 holes will not do magic, but what will follow after that for coming 2-3 weeks is something which you want to avoid, and that's why I want you to read about these symptoms and all. Okay, yes. Now this is something which sir was asking, and I would like to cover that, and before that I would like to ask from your perspective, what all do you think you do when you go for a round of golf or maybe a range session for like 3 hours? All right. So please see, the more interactive we make this session, I think you all will correlate, and I'm sure everybody is watching each other's play. You guys are playing tournaments with each one of you. So anybody who would like to understand what they do throughout the day if there's a competitive round? So if you may.
This is like ritual stuff.
Yeah.
The left shoe before the right.
Yeah, okay. Sorry, sir? Yes, some stretching. Yes, that's good. Nice. That's good. Start with small swings. Yeah.
Visualization, I do a lot of
Yeah. Visualization, another very good mental thing. Yeah, third.
Visualization is done 1 day before in the night.
Yeah. Fourth. Anybody? Hydration, I think. Sorry? Okay, nice.
Make yourself mentally, prepare yourself that yes, boss, tomorrow is.
Mental preparation. So you're moving 1 day ahead of the time. Yeah, that's fine. All right. All right. So once we cover this slide, I want everybody to think about it and put a structure to your routine. And this is something which is very easy. It will barely take close to 45 minutes extra of your day. That is it. Nothing more than that. I'm sure if you are playing 5 hours of round, I'm sure you would be happy to contribute another 45 minutes to that. Does everybody agree to that?
Absolutely. Yes.
All right. Let's start. Let's start with fueling. How many of you do right amount of fueling apart from cigarette, which ma'am mentioned? What are your fueling patterns before you hit the golf course, or before you head out for a round or a course session or a range session?
You have breakfast in the morning.
Yes, yes.
And then you have 1 or 2 glasses of water.
Correct.
And after that you're on. And in between you have a little bit of water.
Correct. Nice.
Wherever you find that.
Have some?
There must be a gap after you eat or something.
Yes, correct. So I think everybody of you is right, and I'm sure everybody knows what to do. It is just we are not doing it more mindfully, and that's what I encourage all my athletes, including all of you now. Start thinking like a professional athlete. It is no difference. I'm sure everybody is eating breakfast, but what are you putting on your plate is equally important. Sir mentioned water, but I would also recommend some amount of electrolytes through that, because everybody is feeling the heat because the summers are all around the corner. Add some amount of electrolytes before you hit the ground, before you hit the course. Put some electrolytes in your bag as well.
Electrolyte means you just pack one packet and then put it in the water, or are you talking about something else natural kind of?
No, it's purely electrolyte. You can take a basic electrol packet. There's fast enough reload. There are different kind of salts available in the market. You can have them in the morning before the round begins, and then you keep sipping them throughout the round. It is not just about having one time, but you continuously do it, because that's where your electrolytes are being lost. And we need to replace them. Generally, a lot of people drink water, but that plain water will not do good. You need to keep hydrating. Yeah. Followed by a good mobility routine. Sir mentioned that he follows stretches routine. I would say, how many of you are okay to spend 20 minutes on your body before you hit a golf course? Yeah, it's easy, right? We're going to do a practical hands-on session. You can clock it if you want, but I'm pretty much sure it will not take more than 20 minutes. And that's very simple. You start with basic releasing of your body, add some mobility routine to your body, maybe light amount of stretches, and then some amount of muscle activation to boost your swing, to get that stability, to fire them or potentiate them, in a very simple word. It should not take more than 20 minutes, and that's a simple routine which you can do. You can do it maybe an hour and a half before the round itself. You don't have to come to clubhouse and do it. If you're doing it here, that's fine, but even if you're doing it maybe 1.5 hours away from the golf course at your home, you got up. I have a very funny story actually. I was working with a gentleman who was 65-year-old and even beyond that, I think. And he has just picked up sports science. I mean, he was working with us. And one day he came to me and he's like, Sumit, you know what happened today? I got up and I was doing my foam rolling and I was having a round, so I was doing my foam rolling and everything. And then suddenly I see my wife waking up. And it's like, what are you doing early morning, 4 o'clock? And then I realized I lost the track of time because I was so much in that mental preparation that, okay, I forgot my round is at 9 o'clock. I've woken up at 4 o'clock to follow a routine. And that's a real story. I'm not even kidding on that part. So yeah, so if you pick up good habit, trust me, it will become something which will come very naturally to you. You don't have to think about it. The moment you get up, you do your morning routine, you pick up a foam roller, you start doing a routine, and that's how you begin your round day. Followed by the amount of practicings which you generally say, which sir mentioned on the back, that you start with very low intensity swing, maybe around the greens, then you build up your swing from 9, 8, 7, 6, 5, then pick up the woods and drivers. So there has to be a routine which you consistently follow. Generally, all our athletes, all our professional athletes, they have say 5 drive hits, 4 woods hit or something like. They have a particular number of shots which they hit before the round. Right? And that's something which you want to mention. But yes, start by building it slow and then build it up to the driver. Don't start by smacking the driver on the practice range first. Then comes the on-course. Now this is something I feel will also help you, finish strong. That 10th, 11th, 12th, following it till 17th or 18th, you need to be very well hydrated. The energy levels has to go up because after 2.5 hours, the energy will start dropping. So the amount of food which you had in the morning will start slowly disappearing from the blood. And that's where you want to replenish something from with the right nutrition to fuel it up, and the muscles should have more nutrients to generate more force. And that's something which we generally call as caddy fueling, where you understand that every third hole I have to say pick up 2 dates or say cashews, or you can have a small protein bar, energy bars. You can add electrolytes to it. You can have bananas, simple carbs to that give you that quick energy for next couple of minutes, and then you keep refueling after 3 holes, 2 holes. And again, it is, and I completely get it. The moment you are on the course, your brain is only thinking about the performance. Into your habit by doing it. Yes, sir.
Exercise to improve your muscle mind muscle body. Just begin golf.
Okay, so then that is generally out of my area of expertise. We have our sports psychologist who deals with that. But I'm sure to answer you, at this point of time, I cannot answer right now. Yeah. It's very different, but a professional help would, come handy because. Yeah. Yeah.
Personally, what I find is routine helps keep me centered.
Yes. I think that's how we have sum up our routine. But guess what is missing on the bottom?
After the round warm-up.
Cool. Cool down. How many of you follow a good recovery pattern after the round? Okay, what are the things you do for the recovery after the round? Let me put it more simple. 19th. Okay. Again, that's something I believe is very, very important, and we at TSG, we are always emphasizing on people for focusing on the recovery, because last week a lot of athletes were struggling in Vizag. Professional athletes, there was a PGTI tournament, and we keep getting those messages from our professional athlete, but they're literally struggling because the heat is so much there. In that case, a post-round recovery, a consistent post-round recovery pattern should help. Now, what I mean by a post-round recovery is very simple. Fuel up yourself so that you replenish all the energy sources. You stretch your body so that you're physically more recovering. Hydrate well, because you've lost so much water you don't even realize. I mean, the moment you take a leak, you will understand that how much the urine color is happening, and you can keep a track of it. I'm sure all of you are doctors, and I think you guys know more than me on this part. But that's something which we want to keep it in our mind, that we have to keep a consistent recovery routine, because there may be a chances where you're playing 3-day tournament. Within your own group or in a professional setup, you may be playing 3-day. Even if not, some next day there are chances that you may have to go for a work, but you don't want to be tired. So that you need to set up a consistent routine. I mean, it will again take not more than 15 to 20 minutes. That's as simple as that. And apart from that, a cold shower, ice bath, pool sessions, whatever you feel like is working for you is always will always come handy. Anything more on this part? Yes, sir. Yes, sir. That is after the round? Yeah.
Finish your warm-up and immediately go, or you can give a break?
You can take some time, sir. The effect of warm-up will last for around 90 minutes, so you can sustain it.
How much time?
90 minutes, close to 90 minutes, so yeah. But if you are doing it here, should be okay also. I was watching, 2 days back, I was watching a podcast, Rory McIlroy podcast, and he himself mentioned that he reaches the golf course 3 hours ahead of time. He will go through his routine, he will do his mobility, he will do his activation, he will do his mini strength session, low intensity one, and then take a shower, visualize, and it's a consistent 3-hour routine. He said that the day I do not reach there 3 hours, I am very nervous. My anxiety kicks in, yes.
Any tips on how to maintain your concentration through all the 18 holes?
I think concentration.
You kind of deteriorate by about 12, 13, 14, 15.
There are so many reasons. I think you can work on the concentration. I think in my area of expertise.
So is it because of tiredness?
Of course. Nutrition plays quite important role. If you're mentally and physically fit, I think you will not have that loss of concentration. But if you're body-wise, energy-wise low, if your fatigue is kicking up, if there's heat and you're losing too much water and you're draining, obviously the concentration lapse will happen. Kushalappa, anything you want to mention?
Yeah. To add to that point, so if you look at a lot of data around injuries and how they happen, when they happen, so particularly when you're looking at sporting events, so if you're looking 90 minutes in a football match, 80 minutes in a rugby game, majority of the injuries tend to happen towards the end, and that is because fatigue starts setting in. And when you start having fatigue, your mind sort of wanders away to, oh, this is feeling a bit tired, that is feeling a bit odd, then you lose concentration. So I think it's very important to be at a physical sort of level where you can last out the full 18, then the mind settles down and you're able to concentrate better. So it's very important to sort of be conditioned. So conditioning is important.
That's why the earlier point where strength and stability was covered, it is also to mention that you should play 18 holes, like the first and 18 should be same. It should not be an inconsistent. And likewise for any professional tournament, the third day of the tournament has to be as effective as the first. So I think we have covered pretty much thing. To sum this up, I think there are some things which you should do. Warm up properly, manage your workload, get into strength training, don't be afraid of the gym sessions. Get in touch with right amount of trainers. Start with slow and build it up. There's no limit to it. Fuel and hydrate well. That's something which you want to work on. Don't play through pain. That's simple summation. Don't neglect recovery. Don't just rely on technique. You want to generate forces through your muscles. So make them strong, strengthen them, and most of all, don't miss out on the rest days. Now, what do I mean about the rest days?
After the session, whatever the body recovery time that is required, you have to give them.
That's more of the recovery part. Rest days are in between two competitive rounds or in between two practice sessions or something. How many of you, I mean, obviously everybody is a working professional here, I'm sure you're busy, but do you do something on those rest days to make sure that you're preparing your body for the next day? It could be any activity. Walk, yes. Sorry? Aerobic exercises, which is very great, yeah. Swimming, again, lovely sport. So we subcategorize into 2-3 parts. One is mental recovery and physical recovery. It's very simple. For the physical recovery, for the mental recovery, I think taking off time from the golf, getting into a zone where doing things which make you mentally detached from the sport and makes you feel little happy about the day. And the physical recovery is more about, working all those activities which Sir mentioned, that aerobic activities, maybe a walk, a light gym sessions would do, a good mobility routine would do. If you feel there's some amount of your, some part of your body which is not stable through, adding some small band work day, which would also do. I mean, you don't have to go very high intensity. You just have to spend around 30 to 40 minutes on that particular day to make sure that you're working something on that recovery part on that particular day. And that's where I believe the rest days are very, very important, And yeah, I think this is from my end. I think we've covered quite a few things. I'm sure a few of you and most of you have learned something out of it. We're going to have a practical hands-on session how a day should look like. I'm going to help you set up your routine, maybe add some band activations which you can do before the round. I'll also share a full PDF plan which I thought it will come handy for you. So you can give me your mail IDs. I'll mail it across to everybody. I've attached some YouTube links to that, so in case if you want to read, and if you have some further questions after that, please feel free to reach out to me. And anything from here and here, I think please, I'm happy to answer.
Is there a difference between trained golfers versus self-learned golfers?
Trained golfers, as in, so, I mean,
Who have learned coaching
yeah.
and learned golf?
This is more with regards to the technicalities of the golf. I mean, see, I feel if you're doing things in a very traditional way, the chances of injuries will be lower. That's the advantage which you'll have. Any unorthodox movement in the body which always put that risk of injury. I think that's the simple answer which I can think of. Yeah.
For me, for example, I played 18 holes. I was a YouTube golfer. I just watched a bunch of videos, got onto the course and just started hitting. Yeah. So I never had an issue with getting the ball off, but I had an issue with consistency. Yeah. So I didn't know where it was going or what my body was doing. Injury does play into it, because if you don't have things that you're repeating and every time you're adding a new element to it, you're opening up the door to sort of having an injury, and also you're opening up the door to not understanding why you're having the injury, because you're adding too many variables. So I think the least amount of variables as possible and having a swing that is sort of yours and it's trained into it, the more chance you're going to get better sort of results which are more consistent, and also avoid injuries from happening as well. So that's where training sort of comes into it. There are a lot of sports that you can pick up without any training, and I think that happens more at a younger age group also, because your body is just more adaptable and more flexible, so you can do things and the next day you feel fine. Here I'm at a point also, and I do something new and the next day I'm not at all. It takes me a week to recover from it. So I think that also matters a lot. Yeah. Oh. So we'll share it. We'll share it with everyone.
Sure.
So one thing that I want to sort of ask, because I've come across this a lot, especially with sort of elder age athletes, it's this fear of going to the gym. I don't know if it's a misconception, because I think one of the questions over there is the more I do with weights, the stiffer I get. And I think that comes up with the ideology that the person that goes to the gym is the big buff guy who's a bodybuilder, can't reach around to scratch his back, can't reach around to do, which is not true. And the gym is basically from a space, it gives you access to weights that you would normally not have at home. See, body weight exercise will take you to a certain level, But if you want to break through that ceiling, you have to add weights that go beyond body weight. And the equipment, everything is much more that you can sort of get in gym than you get at home. And in terms of training, you have different types of exercises. So you have isometric, you have concentric, and you have eccentric.
Yeah.
So when we're looking at muscle flexibility, you're looking at eccentric exercises. So you're looking at lengthening a muscle and putting load on it. So it's not that we're looking at the bodybuilder where you get hypertrophy, but we're actually looking at getting flexibility by also strengthening the muscle.
But somebody with a lower back problem.
Can still do it.
Yeah, still do it, sir.
Still do it. You just need the right guidance.
Yeah,
so that's why
correct.
someone like Sumit will be perfect
That's a
because
myth
he
that
understands.
lower back people with the lower back cannot train in the gym. We have we deal with so many injuries in our professional setup, but we do not let anybody rest. I mean, even if I've trained a person with a fractured arm. I mean, he's the one who has worked with a lot of injuries. I mean, we work hand in hand. But we understand, see, rest is all about giving that particular area enough recovery time. But apart from that, if you are working with the right kind of trainer, he knows that a person has come with a particular injury. In your case, there's a lower back. He can still manage that session to be as effective as any other day. Yeah.
Any advice for those who have got vertigo issues?
Vertigo.
Vertigo.
In this, I mean, vertigo would be something that we probably have to understand a little bit. So vertigo, the underlying cause would need to be sort of defined. And then after that, I mean, in terms of golf, the only thing that I can think of from a rotational point of view. So if you're too sort of excessive, the head is not stable, then it can cause you issues. So I think if we're working with someone vertigo, try to understand underlying problem. And then in terms of head stability, so working a lot on your trapezius muscle to make sure the head stays stable when you sort of rotate. That would be the most I can think of.
Yeah. I think we are working with we are talking to one of the most intellectually right people to work around, because I think every time, I mean, even when we are working in a collaboration with an injury, I always seek his perspective of whatever injury I am pushing him to. He always guides me up, okay, this is the certain movements which you want to avoid. Apart from that, I think feel free. And I mean, again, depending on person to person, doctor to doctor, what they, advise to a particular trainer or physio. And yes, I agree that, a lot of times that collaboration doesn't happen, but it should happen more often. I mean, there's no harm in doing that. At the end of the day, our athletes are getting benefit out of it. And that's where I feel, I mean, every time I have a second thought in my mind, I always reach out to him. And I'm sure whenever we are discussing a case, he's always open to discuss. So I think that's how it should be, discussing a lot more things. Yeah.
Yeah, so I think we'll split into, so Sumit is going to run a session to just sort of take you through certain techniques and activities and stuff like that.
Yeah.
And then I'm going to be over here just consulting anyone who has any sort of injuries, issues. So we can break up and then do it, and you do a couple of rounds? Or?
I'm okay. I mean, whatever everybody is okay with. I can do it in groups also.
Yeah, so we can maybe do it in groups.
Yeah, sure. Yeah.
Yeah, don't worry.
Yeah.
Yeah.
All right. Thank you. Yeah.